Podium! Grab the podium! Podium!
I'd like to thank you for taking my question, my comment, first of all. I'd like to thank everybody here for taking my question. Congressman, I know you don't agree with me on this point I'd like to make, and you've alluded to it before. And on your website, you say that it's a bit of misinformation. And I'm very concerned about sections 1233, pages 425 to 430 of the bill. It talks about mandatory end-of-life planning, including euthanasia, basically, okay? Now,
Please. Letting each person who is recognized by the floor speak.
thank you. Ezekiel Emanuel, who is Rahm Emanuel's brother, was appointed Chief Health Policy Advisor to President Obama. And he published an article January 31st, 2009 in the British Medical Journal, The Lancet. And there he was appointed to do comparative effectiveness research to begin a design of a federal system for withdrawing care from those chosen for death. This is a quote from that. It says, when implemented, the complete life systems, that's what it's called, complete life systems, produces a priority curve on which individuals aged between roughly 15 and 40 years get the most substantial chance for treatment, whereas the youngest and oldest people get chances that are attenuated. This may be justified by public opinion, since a broad consensus favors adolescents over young infants and young adults over very elderly people. Now, there have been people here that have made impassioned pleas for how do those of you who oppose this legislation, why? How can you look at yourself at night? This is one of the reasons why, because they are going to target. There's not going to be enough money to run this system. In Canada, they wait 17 weeks. To get an average appointment for health care. Another thing that I'd like to say is that I am a registered nurse. I graduated from St. Francis Hospital. I received the Sophie Ross Award for the most compassionate nurse. I was an acute care nurse at the bedside. I took care of patients in the hospital who were actively denied food and water because the state appointed a conservator to them. They didn't have a family that cared. The state appointed a conservator and would pull them off of ICU life support systems. When the state got control, they would shove them in a med-surg room and say, guess what, all this expensive care is not worth it, which I can kind of agree with. They did do some things that they shouldn't have done on these chronically ill people that were dying. But to deny them food and water, it was a painful death. It was a horrendous death. I witnessed that as a registered nurse. I am troubled by this. I am troubled by these provisions. Thank you for taking my question. My name is Lisa. I'm from Eastford.
Thank you.
Thank you. First of all, as somebody who's married to a woman who works as a nurse practitioner at St. Francis Hospital, my hats off to you, and I can just tell that you deserve every award that you possibly, that you were given, because it's clear that you are a caring and compassionate person, and frankly, so am I. Okay, and I'm somebody who, if I thought that this provision in the bill, which I have looked at over and over and over again, required a mandatory action by anybody, I would never, in my wildest moments, ever support that. 1233 basically provides that Medicare will reimburse a doctor, such as this doctor right here, once every 5 years to have a session to go over patients with their families to talk about patient directives, which includes living wills, durable power of attorney, orders of life-sustaining treatment, and healthcare proxies, which, my dad, who, you know, was to me my hero in my life, you know, I was his healthcare proxy. He passed away from congestive heart condition, and I remember it like it was yesterday, the day that he and Dr. Adamo and myself sat down and walked through all of these provisions, which is something that empowers patients and empowered him to basically have better control over the decisions that were being made. And you know, that's not a bad thing, that's a good thing. And certainly, if somebody doesn't want to do this, this measure does not require them to do it, but it simply says doctors who are forced to do this on a regular basis, day in and day out, at least are going to get reimbursed once every 5 years for taking out a chart and sitting down with a spouse or a kid and the patient and walking through with them, you know, what the future horizon looks like and what choices and what the law. These are all existing legal provisions that exist: healthcare proxies, healthcare instructions, healthcare power of attorney. I mean, these things are things we passed in the state legislature years ago, and to say that we're you know, going to, you know, not allow doctors to be able to intelligently go over that stuff or force them to do it for free is not fair to them or the patients. And you know, I will say this though, I promise you, I will keep an eye on this, because if the word mandatory or required ever shows up in there, you know, I'd jump off the Capitol dome, because that's obviously wrong to force people to engage in this if they don't want to do it. And I honest to God, I've read this statute over and over again, and I don't believe it does.